a naturally occurring mineral found in soil, water, and various foods, has long been a subject of controversy. While it has been hailed by public health experts for its role in preventing tooth decay, it has also been the subject of numerous conspiracy theories alleging its malevolent use by governments and corporations. In this exploration, we will delve into the history of fluoride, examine the scientific evidence supporting its benefits, address common misconceptions, and ultimately debunk the myths surrounding its alleged evil history. The story of fluoride's association with public health began in the early 20th century when researchers observed that communities with naturally occurring fluoride in their water had lower rates of tooth decay. This observation led to the hypothesis that fluoride played a protective role in dental health. Subsequent studies confirmed this hypothesis, leading to the introduction of fluoride into water supplies as a public health measure. However, with the widespread adoption of water fluoridation, conspiracy theories began to emerge, suggesting that fluoride was being used for nefarious purposes. Some claimed that fluoride was a mind control agent, while others alleged that it was a toxic substance used by governments to manipulate or harm their citizens. These theories gained traction in certain circles despite lacking credible scientific evidence. It's crucial to address these myths by examining the scientific consensus on fluoride. Numerous studies conducted over many decades have consistently demonstrated the safety and effectiveness of fluoride in preventing tooth decay. The American Dental Association, the World Health Organization, and other reputable health organizations unequivocally endorse water fluoridation as a safe and effective public health measure. One of the primary benefits of fluoride is its ability to strengthen tooth enamel, making teeth more resistant to decay caused by acid-producing bacteria. This preventive action has been shown to significantly reduce the incidence of cavities, particularly in children and adolescents. Moreover, fluoride's effectiveness in preventing tooth decay has been demonstrated across diverse populations and socioeconomic backgrounds, making it a valuable tool in promoting oral health equity. Concerns about the safety of fluoride often revolve around its potential to cause adverse health effects. While it is true that excessive fluoride intake can lead to dental fluorosis, a cosmetic condition affecting tooth enamel, and skeletal fluorosis, a bone disease, such conditions are rare and occur at fluoride levels much higher than those found in fluoridated water. The levels of fluoride used in water fluoridation are carefully monitored to ensure safety and efficacy. Moreover, systematic reviews and meta-analyses of scientific literature have consistently failed to find credible evidence linking fluoride exposure to serious health problems such as cancer or lowered IQ. Claims suggesting such associations are not supported by rigorous scientific research and should be treated with skepticism. It is essential to critically evaluate the sources of information regarding fluoride and to distinguish between credible scientific studies and unfounded conspiracy theories. Unfortunately, misinformation and fear-mongering can spread rapidly in today's digital age, leading to unwarranted concerns and distrust in proven public health interventions. In debunking the myths surrounding fluoride, it is also essential to acknowledge the ethical considerations involved in public health interventions. Water fluoridation is a population-level intervention aimed at improving oral health outcomes for entire communities, particularly those with limited access to dental care. Decades of research have shown that the benefits of water fluoridation far outweigh any potential risks, making it a cost-effective and equitable strategy for reducing dental caries. Furthermore, the implementation of water fluoridation is subject to rigorous oversight and regulation by public health authorities to ensure that fluoride levels are maintained within safe and effective ranges. This evidence-based approach is essential for safeguarding public health while addressing concerns about potential risks. Fluoride, a naturally occurring mineral found in soil, water, and certain foods has been a subject of controversy for decades due to its presence in public water supplies, dental products, and various industrial applications. While fluoride is widely promoted for its dental benefits in preventing tooth decay, there are concerns about its potential dangers when consumed in excess or when exposure occurs through various sources. Here, we'll delve into some of the dangers associated with fluoride, dental fluorosis. One of the most well-known risks associated with fluoride is dental fluorosis. This condition occurs when children consume too much fluoride during the early stages of tooth development, typically between birth and 8 years old. It leads to the development of white streaks or spots on the teeth, and in severe cases, it can cause staining and pitting of the tooth enamel. While dental fluorosis is primarily a cosmetic issue, severe cases can lead to enamel damage, which may increase susceptibility to tooth decay. Skeletal fluorosis. Excessive fluoride intake over an extended period can lead to skeletal fluorosis, a debilitating bone disease characterized by joint stiffness, pain, and skeletal abnormalities. Skeletal fluorosis occurs when fluoride accumulates in the bones, leading to increased bone density and brittleness. In severe cases, it can cause skeletal deformities and increase the risk of fractures. While skeletal fluorosis is rare in areas with controlled fluoride exposure, it remains a significant concern in regions where natural fluoride levels in water are high or where fluoride-containing substances are used excessively. Neurotoxicity. There is growing concern about the potential neurotoxic effects of fluoride, particularly on cognitive development in children. Several studies have suggested a possible link between fluoride exposure and neurodevelopmental disorders such as ADHD, attention deficit hyperactivity disorder, and lowered IQ levels. While the exact mechanisms underlying fluoride's neurotoxic effects are still being studied, research indicates that fluoride can cross the blood-brain barrier and accumulate in the brain, potentially interfering with neurological processes and cognitive function. Endocrine disruption. Fluoride has been shown to interfere with the function of the endocrine system, which regulates hormone production and balance in the body. Studies have suggested that fluoride exposure may disrupt thyroid function, leading to conditions such as hypothyroidism, underactive thyroidism, overactive thyroid, or hyperthyroidism, overactive thyroid. Thyroid hormones play a crucial role in metabolism, growth, and development, and any disruption to thyroid function can have widespread effects on overall health and well-being. Bone fractures. While fluoride is often promoted for its purported benefits in strengthening bones and preventing tooth decay, some research suggests that excessive fluoride intake may actually increase the risk of bone fractures. High fluoride levels have been associated with decreased bone strength and increased bone mineral density, which can paradoxically lead to an increased susceptibility to fractures, particularly in the elderly population. Acute toxicity. Ingesting large amounts of fluoride in a short period can lead to acute fluoride toxicity, also known as fluoride poisoning. Symptoms of acute fluoride toxicity include nausea, vomiting, abdominal pain, diarrhea, and in severe cases, convulsions, cardiac arrhythmias, and respiratory failure. While acute fluoride poisoning is rare and typically occurs as a result of accidental ingestion of fluoride-containing products or industrial accidents, it underscores the potential dangers of fluoride when consumed in large quantities. It's important to note that while fluoride has been proven effective in preventing tooth decay when used in appropriate concentrations, excessive fluoride intake from multiple sources can pose significant health risks, particularly to vulnerable populations such as children and individuals with compromised kidney function. Therefore, it's essential to monitor fluoride intake from all sources, including drinking water, dental products, and dietary sources, and to ensure that fluoride exposure remains within safe limits to minimize the potential dangers associated with its consumption.